We are here today at Euractiv's Health Policy Conference. At Euractiv we take policy and policy making very seriously, not because we like the outcomes or because we like the processes that much, but we think it's important. We want to organize the public debate about it, which we're doing today. So we're having a series of panels discussing the different topics related to the Health Union today, the European Health Union, how the European Commission sees the promises and the challenges related to this topic.
The European Health Union created the foundations for something which is absolutely necessary today in the circumstances we are all going through, which is to be ready, to be prepared to whatever can happen. We have those foundations, but also to build a future in the health sector that is very much in line with a competitiveness based on innovation, but that is not for the sake of innovation. It's ultimately for the sake of the patient to make sure that we all have access to a better life.
I think what is very important for us living in the EU is that healthcare is not a privilege, it's a right. So I think healthcare for everyone is definitely a message that we want to push through from Zentiva. And that comes with responsibilities, not only for policymakers, but also from companies like Zentiva to drive that forward. So steady supply, affordable price, increasing competitiveness, making sure that we don't have monopoly for a long time.
First of all, we need to make sure that all legislations are coherent and do not have an unintended impact on pharmaceuticals. Second, we need to make sure that we protect the stable and predictable IP incentive system, which is the backbone of what we do, and it allows us to discover new molecules, and it's the only competitive advantage that we have compared to other regions of the world. And third, we need to reward innovation. We need to understand that investing in health is not simply a cost, but it's a true investment. It saves money in other parts of the system, and more importantly, it actually saves lives.
So I think from today's session, it was clear that the proposed Critical Medicines Act very well complements the proposal for the new pharma legislation when it comes to the security of supply of critical medicines. So a lot has already been done at European level for the management of critical shortages, but we need to move, and we have already switched to a more preventive approach. And that's what also the Critical Medicines Act proposal brings, so that prevention, looking at vulnerabilities in the supply chain for critical medicines and addressing those upfront so that we can ensure supply of medicines for patients in the European Union.
I think the potential of AI in health and in health systems is important, very important. At the same time, we have to take a balanced approach, and I think we have to meet this promise of AI with what I would call critical enthusiasm. On the one hand, leveraging the potential, but also not to be blind about the risks and the challenges that AI may pose within the health sector. Therefore, I think we need robust governance frameworks to harness the potential of AI. I think the EU is providing a lot of lessons, also an innovative model of taking this balanced approach, which is not only good for citizens within the EU, but actually also will provide a good inspiration for countries beyond the EU.
We need to speed up our efforts to complete such a regulation on Critical Medicines Act. It means that all actors should understand clearly that we have a lot of common efforts to achieve very good compromise in many areas. Why? Because patients are waiting, because they need to have access to medicine. It's not about industry, it's not about, finally, it's about our people. How can you live with your children if you have, rare diseases and you need to have medicine every day. Urgent problem, and I am expect that we need to send clear message. Let's do our best as soon as possible.